hazards. I don't see any spills or cords, anything that could affect my safety or my patient's safety. My patient is seated upright. She looks to be calm and pleasant. She doesn't seem to be in any respiratory distress. Skin color is normal for ethnicity. She's not using accessory muscles to breathe. There's no cyanosis, pallor. So I'm going to go ahead and proceed as planned. Pietro?
Yes.
Okay. Hi, good afternoon, Ms. Pietro. How are you today?
I'm good. How are you?
I'm very good, thank you. My name's Kristen, and I'm a Palm Beach Atlantic University nursing student. I'm here today to do an assessment on you, if that's all right.
That's fine.
Before I begin, I'll just make sure that I shut the door to provide us some privacy and perform hand hygiene. And while I'm finishing up washing my hands, do you mind if I take a look at your ID bracelet for your safety? Could you tell me your full name?
Maya Pietro.
Thank you. And your date of birth?
11/13/2003.
Very well. I have the same thing. Thank you, Ms. Pietro. Ms. Pietro, a couple more standard questions for you. Could you tell me where you are right now?
The hospital.
All right. And could you tell me what year it is?
2024.
And could you tell me what brings you here today?
Just a simple checkup.
Okay, very good. So we're both here for the same reason. My patient is awake, alert, and oriented ×4. I didn't notice an allergy bracelet on your wrist. Do you have any allergies I should be aware of?
No.
Okay, so that means that you don't have any allergies to latex, shellfish, medications. All right. And are you experiencing any pain right now?
No, ma'am.
Yes.
Yes?
Yes, you are.
Okay, yes.
Okay, I'm sorry to hear that. Can you tell me where that pain is located? Let's make something up.
My leg.
All right, which leg?
Right leg.
Okay, where's
Lower.
your right lower leg? Okay, all right, we're making progress. I'm so sorry that you're having that right lower leg pain. Could you tell me when that began? Just now.
Yeah. 2 days ago.
Kidding. 2 days ago. All right. Did you do something that caused yourself to like start to experience pain? Was there an incident that happened, or it just began to hurt?
Not that I remember.
Okay. Could you tell me right now as we sit here what that pain score is on a scale of 0 to 10, 10 being the worst pain you've ever had?
A 6.
Okay, that's pretty significant. I'm sorry to hear that. Could you tell me more about how it feels so I can better take care of you? Like, is it, describe it for me. A throbbing pain. Have you tried to do anything to make it feel better?
I put ice on it. That's about it.
Okay, and when you put ice on it, did it get any better?
It did feel better.
Okay, how much better? Scale 0 to 10.
Maybe down to like a 3.
Okay, well that helps some. I'm glad to hear that. Is there anything that makes it worse?
Standing on it.
Okay, we'll keep you seated today then. Does the pain radiate anywhere, or does it stay right localized to that right lower leg?
No, it stays right there.
All right, and this is a recent pain that has come, so it doesn't, like, it's not affected by time of day.
No.
Day and night, it feels the same just when you're up and walking on it.
Yes.
Okay, Ms. Pietro, I'm sorry you're experiencing that pain. I want to take care of that for you. I'll do the best I can to do that, and I'll be mindful of your leg as we move forward.
Okay.
Is that okay with you?
Yes.
Okay, do you have any questions for me before I start?
No, ma'am.
All right, so we're gonna finally get started here. I'm gonna start with your hair, skin, and nails. Do you mind if I palpate your scalp, touch your scalp?
No, you're fine.
Okay, so I'm gonna be looking at my patient's skin integrity on her scalp. I'm looking for any rashes, any moles, any lesions. I'm noticing that she has a even hair distribution. Her hair seems to be thick. She looks to be well groomed. I don't see any nits or lice at the base of her neck. I'm also observing the base of the neck for any signs of skin breakdown, like non-blanchable redness. I don't see any redness at the base of her neck, on her shoulders, her scapula, either elbow, assuming they were exposed, the sacrum, and the heels. All right, next I'm gonna be feeling your skin for warmth and dryness. I'm gonna work my way from head to toe, the backs of my probably cold hands, down your arms to your fingertips, and then all the way down your body towards your legs and your toes. It's normal to be bilaterally warm and dry, which you are, and at your toes I would push on the nail beds and look for a capillary refill of less than 3 seconds, which is normal. I don't see any edema or swelling in her lower legs, ankles, or feet. If I did, I'd want to see if that edema was pitting or not pitting, but I don't see any, so we can move on. The nail beds, again, this time I'm going to make sure that her cap refill is 2 seconds or less. It's like 2 seconds, which is a normal finding. Next thing I'm going to do is a test called clubbing. For this test, if you could put your 2 fingers up, and then you're going to bring your first knuckles together and make a heart for Valentine's Day. Very good. I see a small diamond there, which means you're negative for clubbing, which means that you do not appear to have any issues with some chronic low oxygen levels. Next, I'm going to go ahead and just take a peek at your forearm. I'm actually going to give your forearm a squeeze. This test is called tenting. I'm going to squeeze your skin and release. The skin does not form a tent. It snaps right back, which indicates that you have good elasticity and your skin is well hydrated. Ms. Pietro, can you tell me about a mole that you have of concern today?
Sure.
Okay,
I have a lot,
thank
so.
you. All right, so what I'm going to do is I'm going to talk to you about a screening tool that we have. It's the ABCDEEFG acronym, and this is to help to screen for skin conditions that could indicate melanoma. It's not diagnostic, it's just a screening tool. So the A stands for asymmetry. This is a symmetric mole, which is normal. The border is well defined. It's not faded or jagged, which is normal. The color is light brown. Has it always been light brown?
Yes.
Okay, it's smaller than a pencil eraser, which again is a negative finding. It is not elevated, it's flat with the skin, and it wasn't firm, it felt the same texture as the rest of your skin. Since you first noticed this mole, has it changed at all or grown in size?
No, ma'am.
Okay, so in no way it has changed?
No.
Okay, so based on that screening tool, I don't see any signs there that this is a mole of concern. However, if you're concerned, you should always visit a dermatologist to have that double checked. Okay, there's something to be said about intuition. All right, next we're going to move on to respiratory. I'm going to check your AP to lateral ratio. I see that it's 1 to 2. She's not barrel chested. I'm going to do a test now for spinal tenderness. Can you roll your shoulders forward so I can find the top of your spine? You'll feel my fingers wiggle my way down the back, feeling your spine. And what I would like to know is if at any point during this you feel pain or tenderness. Any pain? Okay, all the way to the base, and then at the sacroiliac joint, any pain here? Okay, that's normal finding. Next, I'm going to find the base of your ribs. Sorry, that's ticklish. Marking that spot. This test is for CVA tenderness. Any pain?
No.
Okay, at the CVA angle, no pain there. And same thing on the other side. Where are you? Right there. Okay, starting up high, some taps on your back. Any pain there? No. Okay, so at the angle of the costovertebral angle, I should say, there was no tenderness, which indicates that she does not have any kidney tenderness at this time. Next, you can kind of sit up, and I'm going to ask you now to help me out a little bit. I'm going to need you to take some big deep breaths so I can listen to your lungs. I'm going to start at the bases. If you could breathe in and out through your mouth once you feel my stethoscope on your back. I'm going to start at about the 10th rib space, and then go ahead, Miss Piedra, all the way in and out. Making sure to wait all the way till exhale is over before I move in a ladder formation. Go ahead, do it again. All the way till the end of exhale, very good. And then for time, I'm just going to show your classmates the placement at the 6, midpoint between the scapula. Moving in a ladder formation to the opposite side, up to the 2nd intercostal space, to the opposite side, to the fossa for the top of the lung fields. Could you put your arms out like you're an airplane? Thank you. In the mid-axillary line, and same thing on the other side. Okay, so her lungs were clear to auscultation. I'm going to move on now to palpation. So the first test I'm going to do is for chest expansion. One more time, you'll feel my hands on your back now. Marking my palms at the 10th intercostal space, squeezing in and up. Go ahead, one big breath. She already knew what to do. Look at that. And breathe out. Very good. Okay, my hands rose and fall symmetrically. That's negative for pneumothorax. She had equal chest expansion. Tactile fremitus is next. So for this test, you'll feel my hands again on your back. And for this test, I need you to help me out by saying the word 99 with some authority. Okay? All right, so starting at the 10th rib space, ulnar surface of my hands. Go ahead.
99.
Very good. Again.
99.
Again.
99.
Again.
99.
Arms like a T.
99.
Good. And for that test, I was feeling for vibration. I did feel vibration in all of the lung fields, and it was equal in every location, which is negative for consolidation. Next, I'm going to find the 10th rib space again. This time I'm going to be listening, so you can just relax and breathe normally. That's there, so I'm going to go, I guess, here. And you'll feel some taps on your back. Again at the 6th. The 2nd. The fossa. Sorry, I think I just stabbed you. Don't have nails at your checkoff. Okay, good. And all those sounds were resonant, which is a normal finding. No signs of hyper or hyporesonance. Last, we're going to move to the front. I'm going to listen to your right middle lobe now, just with placement starting underneath the right clavicle. I would ask her to take 4 more deep breaths underneath the right clavicle, moving in a ladder formation to the left, down 1 rib space, and back over. Again, all those lung sounds are clear to auscultation. So now I'm going to listen to your heart, if you're okay to continue to proceed.
Yes.
So for this part of the exam, you could just relax, breathe normally. Actually, the more calm you are, the easier it is for me to hear your heart, okay? So I'm gonna start by finding the second intercostal space, so moving underneath the clavicle and then finding the first rib space and then into the second rib space. At the second intercostal space, right at the sternal border, is her aortic valve, which is an S2 sound. Moving across the sternal border to the left of the sternal border in the second intercostal space is the pulmonic. Down one rib space is Erb's point. Into the fourth intercostal space off the left sternal border is the tricuspid valve. That's an S1 sound. And then could you raise your left arm for me? At the midclavicular line, fifth intercostal space is the mitral valve. That's also an S1 sound. This is also where I would listen for the apical pulse and the point of maximum impulse on palpation. Switching to the bell. Listening again to the mitral with the bell for duller, lower pitch sounds like murmurs. Okay, put your arm down, and then again at the tricuspid, Erb's point, pulmonic, and aortic. Okay, so you can go ahead and lay down. While you lay down, I'll describe what I found. I heard S1 and S2, S2 louder at the base, S1 louder at the apex. I didn't hear any abnormal heart sounds like murmurs or rubs or heart sounds like S3 or S4. I would listen to the heart again because some heart sounds are positional, but for time's sake, I'm gonna go ahead and move on. I'm gonna listen to your arteries, starting at the carotid. Could you kind of lift your chin towards the ceiling? And here, I'm listening to make sure I don't hear any whooshing or turbulent sounds, which would be a bruit. And you point to the end of your sternum. Okay, right below that would be the aorta. Listening again for bruits. Down an inch, out an inch is the left renal. The right renal. Can you point to your belly button? Okay, and then belly button, 45-degree angle, iliac, and right iliac. And then stating femoral. No bruise or auscultated, which means it's safe to palpate your carotid. I'm going to start with your left carotid, feeling for strength. That's a nice +3. And that's also a +3. Doing those one at a time for the patient's safety. Doing the radial simultaneously, +3. Stating popliteal would be behind the knee. Behind the heel bones would be posterior tibialis. +2, you have great pulses. And then here on the top of the feet, move through these fun socks. But we'll go with plus, I'm gonna skip it for the sake of time, +2, we'll say, I'm sure it's there somewhere. Okay, next we're gonna move on to the last part of the assessment, which is abdomen. Okay, so for abdomen, I'm gonna start with inspection. I see that her abdomen is flat. I don't see any obvious protuberances like hernias or tumors or masses. I don't see any bruising, which would be ecchymosis. I don't see any jaundice. I don't see any scars. So I'm gonna go ahead and proceed. Are you currently experiencing any abdominal pain? Okay, at this point I would auscultate starting in the right lower quadrant. When I listened to the renal and the iliac arteries, I actually heard bowel sounds, so I'm going to go ahead and skip that. Her bowel sounds were normoactive, and I'm going to go on to the percussion. So point to your belly button again for me. That just helps me know where the quadrants are. Okay, starting in the right lower quadrant, some taps on your belly just like on your back. You can move your finger. That's tympani. Very good. Okay, so all her abdominal sounds are tympanic. Next, we're gonna go to palpation. So this is for tenderness. If at any point while I push on your belly it causes you pain, just let me know. Starting in the right lower quadrant with one hand down about 1 centimeter or 2, watching her face. If you have a patient who's ticklish, the more firm you are, the less likely they are to giggle. All right, and watching her face, shouldn't appear to grimace. Did that cause you any pain? Okay, so next is deep palpation. This time it may feel a little bit uncomfortable, but it shouldn't be painful. It is a little uncomfortable. Using my right hand on top to apply downward pressure, pushing down, and then a rocking motion. Moving again to the right upper quadrants. Left hand down, right hand on top. Very good. Same thing on the next one. Pushing down and then rocking. It's kind of gross, right? Doesn't feel good. Okay, good. But I don't feel any masses, so that's a normal finding. Last, I'm going to finish up with the liver and the spleen. I'm going to find your rib cage. This is called the hook technique. Is this the end of your rib cage here? Down a little bit more. It's kind of low. With the pants, it's like sometimes hard to tell where the waist is and the ribs are. Okay, good.
I have a lot of space.
Okay, that's okay. All right, so I'm going to put my hands here, and then what I'm going to ask you to do is take a deep breath. When you breathe in, I'm going to move my hands underneath the rib cage. Go ahead and release. Very good. No signs of hepatomegaly there. Now I'm going to reach across your body. I'm going to roll you towards me, but you can go ahead and lay back like you're supine. Very good. That's just to bring the spleen forward, finding the rib cage here. You're down here. All right, very good. And then one more deep breath, moving in underneath the rib cage and release. Very good. I don't feel the spleen either. Nice and soft there. That completes our assessment. She's negative for splenomegaly, so I'm going to help you sit up. You're laying down for a nice nap. And that completes the full assessment that we have today. Is there anything else I can do for you?
No,
before I go? Okay, very good. All right.